Good morning and welcome to the Talking HealthTech podcast. Today we have three wonderful women with great experience and we're going to be discussing the pan-cancer project around the Movember, which is coming up. And we are looking at chatting between four women today, which is quite exciting, looking at our pan-cancer project. So I'm going to start by introducing our three wonderful women today. We've got Sarah Weller, who leads Movember's global prostate cancer team and is an experienced healthcare leader with 2 decades in cancer care leadership. We've also got Professor Bogda Koczwara, who's our medical oncologist at Flinders Centre of Innovation in Cancer in Adelaide, and also the Professor of Medical Oncology at Flinders University. And lastly, but not least, is Cindy Toms, who we've got the Head of Evidence and Public Health Leader in our Cancer Australia. And she's based in Canberra today. So we're a bit all over the country here today. If you guys just we'll start with you, Cindy. Introduce yourself and chat to us why you're here and what relevance you have around the Pan-Cancer project.
Thanks, Ruby. So I am the Head of Evidence, Priority Initiatives and Communications branch at Cancer Australia, which looks after many things, but one of my roles is national leadership in cancer data and how we can bring together various data sets and the like across Australia into a more connected system. And my role, I guess, in this project is to partner with Movember on how we can really embed the patient voice into those data sets and use that data in how we embed clinical care, equitable clinical care, and how we use that for performance monitoring at the national level.
Great. Thanks for that, Cindy. We'll just go to Bogda. We're going to chat to you about your role in this project and the importance of it from a clinical point of view.
Sure. Good morning, everyone. So I'm a medical oncologist working in Adelaide at Flinders Medical Centre. I also am based at Flinders University studying, doing research relating to cancer survivorship. So I have a sort of personal interest in patient-reported outcomes because that's how patients inform me of what their needs are in my clinical practice. And that is really how we capture patients' voices in recognizing what's important to cancer survivors. But I think the reason I'm involved in this conversation is because I also chair the Clinical Oncology Society of Australia Patient-Reported Outcome Working Group, which has been working for a number of years now in trying to facilitate implementation of patient-reported outcome measures into clinical practice in oncology in Australia. And of course, when the Pan-Cancer program was rolled out and announced last year, we were very excited that this is really a strategic avenue for doing so systematically across the country. So I've been following up with interest in what's happening with this project, and of late I've joined the advisory group and thus I'm involved in the project slightly more directly.
Great. Thank you so much. I guess we'll go on to you, Sarah, and then I kind of want to know what is Pan-Cancer project, and just to tell, us laymen's what that means and what's the difference to the current cancer care that's out there. So Sarah, please introduce yourself and then maybe you can start us off with that question.
Yeah, thanks, Ruby. So I'm the Global Director of Prostate Cancer at Movember. And within this role, we're really committed Movember's committed to changing the face of men's health ultimately and really trying to improve the lives and outcomes for men and boys, and through that then improving the lives of communities and society. In prostate cancer, that really means that we're trying to reduce the number of men who die from prostate cancer and improve the quality of life of those who are living with and beyond their cancer. And, what we see in kind of how cancer care is delivered is ultimately that it is delivered not by one tumour stream. It's, we're out of cancer centres, and that's why kind of we're involved in this kind of pan-cancer initiative is we really want to improve the quality of care and drive improved outcomes across Australia. And we know that measuring patient-reported outcomes and experiences and integrating those into care is a really key part of enabling the system to do that. And this project's really trying to drive that change amongst kind of the health system so that individuals will really benefit from that.
That's great. Thank you, Sarah. That's awesome. It's just, I'm really curious to understand the difference to what it's currently like in the environment of cancer care and how you're going to change that with the Pan Cancer Project.
Yeah, so why don't we speak a little bit more about what the Pan Cancer Project is and maybe why it's important. And I think Cindy, you could probably speak to that best at the start, like to kind of give us that national view from the Cancer Australia.
Yeah, I want to talk a little bit about how we got here. So in November last year, Cancer Australia launched the first ever Australian Cancer Plan, and that has an ambition of delivering world-class cancer outcomes to all Australians. So we know in Australia that we have pretty good outcomes, but we don't always do a very good job of measuring it, and not everyone in Australia gets good outcomes. We've got some work to do in achieving equity in the system, and projects like this will help us do that. So the Australian Cancer Plan is underpinned by a strong and dynamic foundations pillar, which is really about the data, research and technological innovations that we need to support the system and make sure we are embedding equity and the patient voice into that system. From a data perspective, we have really good data in Australia, but it's really quite disparate. It's in lots of different data sets. We don't always collect it the same across data sets. And there's often really complex sharing arrangements, and the tech isn't always as interoperable as you would like. We also know that there is some really key data gaps at the national level, and one of these key data gaps really is this nationally agreed patient-reported experience measures or patient-reported outcome measures, which we call PREMs and PROMs. And that is reflected in a 5-year action in the plan. So we're really excited to join with Movember because this partnership will really help us achieve that 5-year goal. And we'll be leveraging what Movember has already done in the prostate cancer space really well across 10 different tumour types. And ultimately, the goal is to be able to collect this data not only at the patient level, like Bogda can talk about why it's important to know this at the patient level and how that impacts on the clinical care of the patient. But what we need to know at the national level is how is our system performing and how do we use this data to make sure that everyone's getting the care that they need. So the project's a $22.5 million partnership between the Australian government and Movember, with Movember generously contributing $17.5 million. And it will work towards these nationally agreed PREMs and PROMs between different tumour types. We'll work together on a platform that we can use that's interoperable. It'll collect the data. The data will go straight into the databases that it needs to go into. And, eventually we might be able to look at a benchmarking system where we can compare services across the board and see how people are going. But Sarah can talk in more detail about those kind of work packages. So I might kind of hand over to you.
Yeah, Cindy, just before Sarah jumps in, just in terms of the specific data points, can you give us an example just so it's a bit more, like we can understand it a little bit more about what, for example, would be one of those patient reported standards or experience that you're really looking at?
I'm not sure I can answer it.
Okay.
I think that might be Bogda or Sarah.
Okay,
I can
great.
jump in perhaps,
Yeah.
and I can give you a sort of a clinical scenario. So let's say, imagine that the patient comes into my clinic and I might look at their scans, and I would say, well, this is great. Your cancer is shrinking. The scans look good. That's a cancer-specific outcome. You could categorize it as a cancer response, or that might have implications on patients' survival expectancy, for example. However, the patient might come to me and say, and this is what used to happen when we used to collect paper-based patient-reported outcomes. Patients would walk into my office and put a piece of paper in front of me and say, have a look at this. And on that, it might be apparent that they have very bad nausea or pain. And that is perception of their own sort of view of how their particular outcomes manifest in them. So that's a patient-reported outcome because it's reported by them, and it might be important for them. So if I can see they sort of patient-reported outcomes, then I can then try to figure out how I can achieve the desirable cancer outcome without the undesirable patient-reported outcomes. If I just looked at the scan and ignored the rest, I may not do as well. And of course, you could argue that clinicians should be very good at recognizing what are important outcomes for patients and should be able to ask whether the patient had experienced nausea. And that's correct. But for some patients, the important thing might be time spent in clinic, or cost of cancer care, or the difficulties accessing transport. And unfortunately, there is very good evidence that we do not ask all these questions routinely. And those questions might be important in terms of health system evaluation, something that Cindy alerted to. So, for example, it might be useful to know whether the burden of access to cancer services is greater for patients living in rural Australia versus metro Australia. And we will only understand that if we ask the patient. So that's why patient-reported outcome measures are important, and also patient-reported experience measures are important.
Yeah, and you can see how that correlates with that data point of view. It's like standardizing the subjective reporting, and I think that's pretty impressive and sounds quite important. Sorry, Sarah, we completely interrupted you. So do you want to jump in for me and just explain why it's important from the Movember point of view?
Yeah, absolutely. I think, building on what both Cindy and Bogda have shared, when we look at, I guess, why, and we know that this stuff's important, and we want to be driving improved outcomes for people, for systems, for Australia. And when we look at why we're not there yet, I think that's partly why Movember's here now, is that we want to help catalyze this change to happen across the system. And I think there's going to be a really large technology kind of backbone to a lot of this, because, some of what Bogda was just sharing around when a patient might bring in their paper-based prompts, now we're really driving towards more electronic patient-reported outcome and experience measures being captured. And the advantage of that is, as more and more cancer centres have electronic medical records, there's greater opportunity for that information to be able to be adhering for the clinician when they're seeing the patient, or even when they're not seeing the patient, to be able to then address that and then provide the, whether it's a treatment change or an early intervention or whatever the shared decision-making might be, it enables them to provide better care ultimately across the system by having that information. And so there's a real technology underpinning, and that's where Movember's, I think, really interested in, is how do we help catalyze this change by firstly getting everybody on the same page. So we're trying to have consensus on a standardized way to measure patient-reported outcomes and experiences across kind of all cancer types.
Yeah,
and,
to then provide individualized care, right? So it's like you standardize, centralize, and then you're providing individualized care to each of these people.
Yep, and I think that there are multiple elements of this, and this is a first step. Right now across Australia, there's some really great examples of where people are doing this work and embedding it in their cancer system, but we don't have it as a standard. So that's, I think, why this has kind of been included in things like the Australian Cancer Plan, because it's really important for us to kind of be measuring things the same way, so that then we can actually be speaking the same language. And as an example of things that might be prioritized, that we think that the different stakeholders are working with might bring forward, it might be things like fatigue or pain or other things that are typically experienced by most people going through some type of cancer care. And that might change the trajectory of their care or the timing of it, or even the support that's given to them. And so when we think about how do we improve care delivery, this is key. And then just really trying to have that underpinning technology part so that people have the right avenues to measure it. There's interoperability so that it's speaking to the systems that they're using, and that there's an ability to even look at mapping that and maybe benchmarking that at a state-based and national level, so that people can understand what does their performance look like.
Yeah, it just sounds so important. And I'm actually quite surprised this is not already something that's out there, which maybe from a different kind of point of view as a clinician. I guess you've just led us into the next question, Sarah, and what is the impact of this initiative on the health tech side of things? And, we're talking about health technology today and digital health tech, and how is that going to impact the Pan Cancer project?
Yeah, so one of the challenges that we see across cancer care delivery is really an ability to collect patient-reported outcome and experience measures in a way that can be meaningful to the health service provider and to the patient. And, we really want to make sure that this project has kind of underlying mechanisms that enable access and interoperability. Obviously, there's a lot of work going on right now within, Australia's kind of FHIR implementation plan, and we're really hoping to be able to use that to help guide kind of the structure of, we will be creating an optional kind of electronic PROMs and PREMs collection platform that people can use if that's something that they need to be able to enable them to collect PROMs and PREMs. And that platform will be able to have those kind of interoperability components. So that's, I think, an important impact that this project should hopefully have on health technology, is starting to bring some of the ambition to life that I think we have across healthcare in Australia. And then making it easy for patients to use. So I think one of the barriers we've seen in the past has been that there might be something available electronically, but the patient hasn't actually been included in the design. And so we really take a really strong human-centered design principles approach to kind of how we build things at Movember. And it's really important because if we're expecting a patient to be using this and potentially even in the middle of their cancer care as well, where they might have other things going on, such as, brain fog and fatigue and other things that might be kind of impacting their ability to just seamlessly function, we want to make this as simple for them as possible.
Yeah, great. That's interesting. And I guess from a clinician point of view, Bogda, what would you hope to see, like, for ease of use of these, health technology?
Look, I think it's worth reflecting that the reason the opportunity is now is because it took a while for technology to catch up with the clinical need. In order for patients and clinicians to engage with this type of service, the process needs to be simple, intuitive, easy. And for that, what is required is technology that can actually deliver. And only now that technology exists with sufficient coverage that applies to the access to electronic medical records through a number of health services, that applies to the use of internet and access to internet for patients at home. For example, it is much easier for the patient to complete PROMs and PREMs in the comfort of their own home for them to reach the clinicians, rather than trying to do it in the waiting room of the consulting clinic in a hurry. But to do that, you actually have to create the technology that supports that in an appropriate, simple, seamless fashion. And that really wasn't as easy. We certainly have conducted trials in doing so before, but the systems were clunky and not terribly user-friendly and not terribly engaging. Yeah. So I think that the system needs to be intuitive, easy, user-friendly. And when we think about it, it needs to recognize that not every patient has got a high e-health literacy, and equally so, not every clinician has got appropriate e-health literacy to manage the technology. So I think that there is a certain time for adoption of technology because the technology needs to fit the purpose. And only now, I think, we're getting there.
Yeah, and still today, I can tell you it's clunky. As a clinician, it's so clunky, and you would understand that too. And
totally. And
10 different systems that you use in a day, and you want to make that a single, easy system.
Speaking to the 10 different systems, the point that I would want to emphasize is cancer, if we get the cancer treatment right, then people affected by cancer will live for a long time. That is a really good thing. But what that means is that we need to have technology that can manage that over a period of decades. And during the decades of cancer survival, patients with cancer diagnosis will move, will change healthcare providers, will change healthcare systems. So those, if we're interested in longitudinal data, our technology has to support that. So we need to be able to support patient-reported outcome collections in New South Wales one day and 10 years later in Tasmania, in acute cancer service one day and in primary care subsequently. And if we want to look at benchmarking and looking at the quality of the care delivered, we need to have a way of comparing those outcomes across different health settings. And that requires fairly sophisticated technology that can last the time. And I think that's why that sort of investment is really, really important, because you cannot plan that level of ambitious undertaking unless the investment occurs.
Yeah, absolutely. No, completely understand that. And I think that it's super important, especially I can imagine, Cindy, from a national level. I'm curious to find out at a national level what that means for like data collection, what it means for I guess, the registries for cancer. Can you explain that a little bit more and how that's going to come into the project?
Yeah, sure. I think Bogda's provided a really good example about how the patients move around the system, and then also how we are in a federated system, so different jurisdictions have different technology or infrastructure, and they might collect the data differently. And it's projects like the Pan Cancer Initiative where we can apply like a national leadership and coordination lens from the national perspective on how we bring everyone together to, one, decide what is the data that's important, like what is the key cancer control question we need answered. What is the data that we need to do that? Where is that data? It might be in multiple data sets across states and territories. And then how do we work together to agree on how we're going to collect it, so standardising it. And then really where the technology starts to really help us, I think, is timeliness. So at the moment, this data is collected in many, different data sets. It probably requires a human intervention to move it from one data set to another, and three years goes by and, you've got quite delayed data sets. So having technology that's interoperable, knowing that we're collecting the data in the same way nationally, kind of speeds up that process. And for clinicians, they'll need to know the answers to these questions in a much quicker time than what we'll need to know nationally. But at a national level, it'd be great to be able to have that kind of data in, a more timely fashion to make those policy changes or look at service improvements and how we provide that care to Australians.
Yeah, great. I think that's an excellent summary of how we can see that working from a national level. I guess just a quick question to the group. Obviously, we speak about patient experience and the PROMs and the PRIMs, and we're looking at how we can make this better patient-centred, which is how healthcare is generally directed. How are you including the patients in this process? Are they part of the standards?
That's a great question. We're absolutely including patients and patient advocacy groups within this process. So one of the, overseeing groups of this is a fairly large consortium that's made up of a variety of different stakeholders across the cancer care sector. So including, research, direct point of care, facilities and decision makers, state health departments, and a lot of consumer advocacy groups as well as clinical quality registries. So there are many different patient groups across multiple cancer types included in that consortium. And then within this first work package that we're doing, which is around the gaining consensus on this standard kind of PROM or PREM and the domains that are important to be included within that, we're about to undertake a really extensive lived experience engagement as well. So we've got a really big piece of work that is really going out into the community across Australia, really speaking with lots of different people who have had or supported people with cancer to get an understanding of what's important to them. Because, when we think about the slogan, nothing about us without us, ultimately we want to be patient-centered in the way that we kind of move this work forward and create the solutions. And the information that comes back from people who have been experiencing cancer care in different ways and supporting those in that setting are really, really important. And this really plays into how we're trying to learn as well. And from a health equity lens, the priority populations, the people who are traditionally underserved and underrepresented, are a really large focus area for some of that consultation work as well, just to make sure that we're understanding. And for people who might fall through the cracks because of various reasons, how do we really hear from their voices as well? Because we want to make sure that whatever is designed is really considerate of as many Australians as possible.
So I would say that it's worth thinking about it as an undertaking that has sort of three categories of stakeholders. Patients are very invested in benefiting from this technology. So we ran a workshop last year just before the announcement where we asked patients and clinicians and researchers of what was important to them in implementation of patient-reported outcomes. And what came out really, really clearly was patients want this to benefit their care. And that's not surprising. When they come to clinic, this is a tool that we know can improve individual patients' care, and they want that to happen. So that's one category of very important stakeholders. Ultimately, that's what cancer care is all about. the clinicians are invested in delivering care that is a better care. And I think that's what motivates clinicians in engaging with a project like that, if it ultimately translates to improving patients' care. And fundamentally, there is a societal investment, and society as large are stakeholders, because we want to make sure that the societal investment in healthcare is appropriately translated into benefits at the societal level. So that means that we should address issues of disparities, making sure that wherever you live in Australia, your care is as good as it can be, and it's not inferior to people who might live in a let's say metropolitan versus rural. So I think that when we think about those three different categories of stakeholders, the project is really trying to capture all these considerations together.
Yeah, it's great. It sounds like you guys are covering all your bases very well. I think in the outcomes and the experiences of the cancer patients, so moving forward, what benefits do you see the initiative having? Maybe let's just go down to a general patient sense, Bogda. So
sure.
What what benefits do you see this initiative having? I'm from a patient sense.
So let me
coming into your clinic every day.
So let me just give you a sort of a hypothetical scenario of what I would like to see. And that is a patient comes into my clinic and I can say to them, look, we received the report of your outcomes as of last week after your chemotherapy, and I can tell that we're still not doing very well with pain control, and the electronic feedback on your outcomes has led to some resources sent to you directly, and the nurse who is controlling the pain control is already waiting in the waiting room to talk to you some more. So this is the immediate sort of benefit that patients providing their own data might impact on the care delivery. The second bit is we have evidence that longitudinal analysis of data can provide direct patients benefits as well. So, for example, I might say, looking at the data on the pain today, I can tell that your pain is significantly better controlled than a week ago. And we know that if the pain control improves that quickly, you've got a very high chance of being pain-free tomorrow, as opposed to if your pain control was poor, where we would say this is unlikely to improve and therefore we need to escalate our care. So these are the examples of immediate tangible benefits to patients. And we know, based on research from other countries, from United States and Canada, we know that if we manage patients' symptoms this way, they're less likely to present to emergency department. They're less likely to be admitted, which gives you a direct benefit in terms of societal benefit of how we spend money on healthcare delivery and how we prioritize interventions, which brings me to the broader picture. If we could actually look at that type of data and compare it to different health settings, different populations, and have some national benchmarking, we might be able to say, well, these particular populations of patients living in those areas or with these particular cancers are more at risk of having poorly controlled pain. And therefore, we need to invest in training of healthcare providers in delivering better pain control, or having better access to pharmacies that prescribe drugs really quickly. Or perhaps we have no idea what the problem is, and maybe we need to do a bit of research to understand what is the reason behind the problem, and then consider what other interventions we may develop and reevaluate our patient-reported outcome data to see whether that intervention improves things. So we have potential tangible benefits both to individual patients, but also to patients that come after them, simply by collecting data in a structured and a systematic way.
Yeah, you get to change clinical care, you get to change the patient experience. It sounds like it's going to make a huge difference to what's currently out there. And I guess just thinking about digital health tech in that we're currently where we see the most benefit out of digital health is through chronic disease. And I guess you could put cancer within that
absolutely
subgroup of chronic disease. And that's where we see the biggest impact, for example, like heart failure clinics. I'm not sure if you guys are aware of them, but that's where my, kind of brain went to when you brought up that stuff, and about, wearables at home, but patient experience and patient proms and prims, and how they can report that from home. That whole old fashioned thought of bringing all the sickest people into one single place is just out. And we really need to think about, what's best for the patient, keeping them in home as long as we can. How can we intervene earlier so that they don't have to come into hospital with a pain crisis, and then they get into hospital and they get a hospital-acquired infection, and then that, can be a death experience for a sick cancer patient. We all know that getting a hospital-acquired infection for these patients is, it can be a deathly experience for them. And it's just, it sounds like even this is going to help with, the severe end of what cancer care looks like. So it's all really exciting. And I think my last question for all of you, and whether that has flow-on discussions, I just want to find out what will come from this and what the importance to each of you is, and where you see this taking. I mean, Bogda, you've already kind of answered it, but talking about the future and where you see this taking us through the future.
So maybe I'll just follow up, given that I've already sort of jumped into this, and that is fundamentally cancer care is about people affected by cancer, which means that they are at the center of what we do. They should be at the center of what we do, and they cannot be at the center of what we do unless we ask them what matters to them. So while I consider myself an early adopter of technology. To me, technology is a tool, but what really matters is the principle. And the principle is patient's voice matters. And our job as healthcare providers, healthcare researchers, healthcare planners is to find a way of putting that voice right where it needs to be, right at the center of cancer care. And I think that's what it's all about.
Yeah, and I see this as really as a building block to help Australia get towards that ambition, right? So what we're hoping to do here is have a standardized way that people are then measuring what's important to patients who are receiving care, so that we actually better understand their outcomes and their experiences, so that we can end up integrating it like Bogda was kind of suggesting. So this is really a building block towards that, to be able to measure it in one way, and also then to be able to understand what that data means. So that's where, when we think about what benchmarking might be able to do, it really helps us understand and translate at a state-based and national level what some of those components might mean when we're trying to look at what steps, do we need to take to improve some of the system. I think probably that might even speak to probably more of the Australia Cancer Plan ambition that Cindy can probably add into.
Yeah, thanks. Look, I couldn't agree more with Bogda and Sarah, and to, I guess, build on your point earlier, Ruby, it's if we get it right for cancer, we get it right for all disease sets. So this is a real opportunity to embed that patient voice into, I think what I see at the national level, it's almost like it's a sentinel system. It's about, hearing about where we can make service improvements, how we can adjust the system based on that patient voice, and ultimately how we can address unmet need, provide targeted supports, and ensure that, as Bogda said, that we are hearing that patient voice and we're responding to the needs of their care within the system.
Yeah, and in a severe disease that affects everyone and doesn't, no person is not at risk of getting cancer, and everyone knows someone who's had cancer. And I think it's not a disease that's going away, and it's something that we really need to focus on and manage on a national level, which it sounds like you guys are doing, and bringing that, clinical national level, and then bringing the patient, and you're basically bringing them together. And I think that's really, really important. It's bringing that, end user of technology and the end user of the clinical practice. And yeah, it sounds amazing. And Sarah, for Movember to, put such a big funding towards this project, as well as I didn't really understand exactly how it was going to work, and you all come together today, and I think you've all spoken so well, and I've really learnt a lot about the Pan Cancer Project, and it sounds like it's going to make an incredible impact for both patients, clinicians, and a national healthcare level in Australia. And I think, you've all spoken, again, really well, and having 4 women speaking about, this is pretty incredible. So thank you for your time today.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.